Good evening. Welcome to Everything You Need to Know About Back Pain. This is Dr. Carlson of Active Family Chiropractic, Arizona at BeWellAdjusted.com. We are going to go over 3 different pieces of research. Some of it is based from the research journals. Some of it is anecdotal evidence. But there are 3 news flashes that I want to review with you. News flash number 1. Chiropractors totally eliminate back pain, back inflammation, and back pain. Oftentimes when you have back pain, you have this feeling of inflammation. The 3 cardinal signs of inflammation are rubor, tumor, and dolor. That's what we learn in med school. Basically, that means it's hot, it's swollen, and it hurts. If you have inflammation, usually pain is going with it. And we innately, intuitively know that if we can get rid of some of that inflammation, the low back pain is going to, or the back pain in general, is going to improve as well. So scientists in a Canadian, Montreal to be exact, lab decided they wanted to do a little experiment. They wanted to figure out a way to take away inflammation. So they hypothesized in 2010 that if someone with back pain got adjusted, that their back pain could go away. So they took a small study, 21 volunteers, and they took the ones that actually had back pain, and they used that as the test group. And then the remaining members who did not say they had back pain, they were the control group. The test group got chiropractic adjustments, 9 of them in total, and obviously the control group got none. So the smart scientists decided that not only were they going to do the adjustments, but they were also going to check and monitor for blood levels of 2 different substances, IL-6 and C-reactive protein. Now you would expect that the people that had back pain also had high levels of these 2 proteins in the system, which was true, they did. But what they found out after they received the 9 adjustments by a chiropractor, those 2 substances actually went down in the bloodstream. Both the IL-6 and the C-reactive protein went back to normal levels, and their back pain went away. So this was a study done in Canada. Only one of the members of the scientific panel was an actual chiropractor. The other 2 just worked in the college. So newsflash number 2. There is a new chiropractic method that restores disc height in elderly people that have disc herniations. This is pretty fantastic news, because if you know anybody who's ever had any kind of disc lesion, disc herniation, you know that they are completely and utterly miserable. They can't move around, they can't get in and out of bed, they can hardly sleep because they can't get comfortable, they can't get in and out of a car, let alone drive the car, and they're certainly not safe driving a car because they're so uncomfortable and there's so much pain that they're distracted. It can also obviously cause relationship issues, both physical and financial. For example, when the man is working and he is the primary breadwinner and he gets a disc herniation, sometimes he can't even work anymore. So normal medical treatment is based on prescriptions and occasionally surgery. Now that can pose a problem because yes, it can decrease the pain, but it's not doing anything for the body's ability to heal itself, nor is it fixing the original cause. It's not even addressing the original cause. So there's a problem with that we're not addressing the cause, but there's a secondary problem that if you're on these pain meds, they're very addictive, and you can end up having to go into an addiction treatment program, which means that they could go on even worse drugs like methadone, which, by the way, can lead to death or be even more addictive. So it's definitely a downhill road to the grave, especially if opiates are the ones being prescribed. Our opinion is you got to get to the root of the problem. You got to figure out what is the cause. If you're having a disc herniation or you're having low back pain, well, that's the effect. That's just what's showing up. That's your body's mayday signal. What is really, truly the cause? So some medical doctors, again in 2010, decided that they wanted to do a little experiment. They wanted to do something called non-surgical decompression. Now, you have to understand that medical doctors also have their version of decompression, but theirs is done under anesthesia in surgery, which obviously has some serious side effects all by itself, whereas chiropractic decompression does not have anesthesia and surgery or scalpels or any of those things. It's non-invasive. So scientists at the University of California in San Francisco, specifically in the anesthesiology department, decided to think outside of the medical box, and they decided to try this non-surgical decompression on patients who had reported low back disc herniations. There was a total of 30 patients. 21 of them were female, 9 of them were male. They were all around 65 years old. Generally, they were overweight, and they had low back pain for at least 3 months duration due to a diagnosed disc herniation. All of them recorded their low back pain on a scale of 0 to 10, which we refer to as the Borg scale. The average for all of them was 6.2. Now, in my office, we use the Borg scale all the time. I say that 0 is no pain at all, and 10 is take me out behind the barn and shoot me, put me out of my misery. I cannot go on anymore. That's a 10. So you understand that 6.2 is a significant pain score that's going to be debilitating them in some portion of their life. It's going to be definitely slowing them down, dragging them down, fatiguing them, shortening their attention, shortening their patience. It is definitely having an impact on their lifestyle. The other parameter that the scientists recorded was the actual height of the lumbar discs themselves. So if you're not familiar with the spine, the discs are what we call little cushions, little pads in between the vertebra. Their job is to push the vertebra apart, which creates a foramen, which is basically a hole for the nerve to exit. It's also a bit of a shock absorber. So when you lose that disc space, you're definitely losing your height, your overall height, right? One of the common complaints of people as they get old is, oh, I'm shrinking or I'm getting shorter. The second is that you lose some of your resilience, your ability to absorb stress. Your body starts to wear down a little faster. So they recorded the height of the lumbar discs themselves. So they took these patients, and over the course of 6 weeks, with more than one treatment per week, so they did a couple of treatments per week, they set these people up on traction, chiropractic traction, where there's a computer, it's set up, you program a rest cycle versus a traction cycle. So they alternate back and forth for several seconds. And then they do this several times a week over the course of the 6 weeks. We are hypothesizing that the mechanism behind it, or the effectiveness, is something called a vacuuming effect. So by pulling the sections apart, by tractioning the spine apart, we're actually sucking the disc back into the spinal cord. Treatments are about 15 minutes long, and they don't cause any pain. They were amazed. Scientists found that the non-surgical version, the chiropractic version of spinal decompression, decreased a patient's pain level from 6.2. Now remember, this is having a significant impact on their life. Took it all the way down to 1.6. 1.6 is, yeah, it nags and you're uncomfortable, but you can totally live your entire life. 6.2 all the way down to 1.6. Their disc heights went from 7.5 millimeters to 8.8 millimeters. That's an incredible growth or restoration of the disc height. Obviously, with that increase in disc height, guess what happened to their pain? Of course, it went down. So this is really great news for anybody that has a disc herniation. Anyone you know that is having a challenge or has a potential challenge or is thinking they have a disc herniation should check into finding someone who has non-surgical decompression as a service that they offer. Not all of us offer not all chiropractors offer all of these services, but in the event that you do have a disc herniation, this is definitely something that you should check out. When you have a disc herniation, there's compression on the nerve roots, and the range of symptoms is all over the chart. Some people don't have any signs and symptoms. Some people just have small annoyances. Some people have numbness. Some people have tingling. Some people have that feeling like ants are crawling all over their skin. Some people have full-blown sciatica. Some people have sharp pain. It can be a broad range, but it can make life really difficult. The other time or other circumstance that this non-surgical spinal decompression can come in as being very beneficial and effective is when somebody has spinal stenosis. So Spinal stenosis, what has happened is after a long period of wear and tear, the body starts to accelerate in the aging process. And in order to stabilize, to protect tissue, the body reads that you're putting too much stress on the body and it needs to bring in the reinforcements. So the reinforcements are calcific deposits on the soft tissues and the bones, which means that you're getting these bony spurs. So the bone spurs develop all around the vertebra themselves, the spinal bones, and you can end up having those foramen that we talked about earlier, those holes or hallways where the nerves are supposed to exit. Those start to shrink because these spurs are growing. People that have spinal stenosis can also benefit greatly from spinal decompression. There's our stats. Newsflash number 3. This one is really interesting. If you are a service family or you have any friends or family that are in the service, or if you're like me, you just really appreciate your freedom. I think we all know that when veterans come back, they have a wide variety of challenges. Some of them are mental and emotional, some of them are just physical, some of them range the whole spectrum. But there's a gentleman in Buffalo, New York. He was a 43-year-old Marine Corps veteran, and he was having some back pain. He had the numbness, he had the tingling, it was in his right leg, radiated up into his back. And the history was that during his time in the military, he had sustained an injury to his back. It was specifically the 4th lumbar vertebra, and it had slipped forward a lot. And additionally, the space in between the 4th and the 5th lumbar was narrowed, and other parts of multiple vertebra above and below, mostly above, were also fractured. So he had sustained significant trauma and he was paying the price. He was in pain all of the time. So he went to New York College of Chiropractic and they treated this gentleman with 10 office visits over the course of 2 months. They used some pretty specific techniques. They adjusted him. They used a flexion distraction table, and they also gave him some very specific homework on how to conservatively deal with his low back pain. He had, now keep in mind, this is only 8 weeks of care. This is all he got. In 8 weeks, his low back pain went down 25%, and he also had a reduction in his disability by 22%. That's pretty significant considering where he started. Now, that's when he quit for whatever reason. I could not find that information. But if he had been allowed to continue, chances are he would have continued to get much, much better. So I'm curious, did you miss these 3 news flashes? It is entirely possible that you did, but you don't have to miss out on the benefits of chiropractic. So let's talk about a couple of facts. What is back pain? Well, back pain is pain anywhere along the back. Could be neck, could be upper back, could be mid back, could be low back, could be pelvis, anywhere along the backside. We usually classify it as either acute or chronic. Acute is generally something that's happened very recently, something that you've had for a period of time, or something that's been repetitive and that it keeps showing up. Usually the general rule of thumb is if you've had something going on for more than 90 days, we classify it as chronic. There are many, many causes of back pain. We can have trauma, such as a football game, weekend warrior, you could be in a car accident, you could get hurt on the job, you can have a slip and fall. That's a big one, especially in the winter back home, Midwest. You can have poor posture, which could be accentuated by sitting too long at the desk. In America, we sit way too much. Sitting is like sugar on our teeth. Sugar on our teeth, sitting to the spine. We are not designed to sit this long. We're not designed to sit in the car and then at work and then back in the car and then on the couch. That's not the way we're designed. So poor posture can be a huge cause of back pain. Could be sleeping on an old mattress. Could be a disease process like osteoporosis or osteoarthritis or any of the other arthrotypes that are out there. It could be a neurologic disorder. It could be the way you sit in your car. There are a wide range of reasons that you can have back pain in general. Why am I stiff? Well, again, many reasons that you could be stiff. I've had people come in and they couldn't even get out of bed. They had to use the bedside, that they were so stiff they had to use their bedside table to help pry them out of bed. Obviously, that's not my wish for you. I would like to prevent you from feeling that way. I think every chiropractor would. And I want you to understand how the chiropractic adjustment can help you. Basically, we realign the spine, we take the stress off the nervous system, and we allow the body and the brain to do what it does best, which is heal itself. Muscle stiffness is just a symptom. It is a mayday signal. Again, are you listening to what your body is trying to tell you? If you don't feel good, or if you're stiff and you're consistently stiff, or you're consistently stiff and there's no good reason for it, your body is trying to tell you something is wrong. Why can't I get out of bed? Well, what you have to understand is that if you're stiff and if you're sore, then your body is guarding. It is protecting you, preventing you from doing further injury to yourself. That's why your motions are slower and more guarded. Things like getting out of bed, you move real slow, or you sit on the bed and you have to stall there for a minute, or you stand up and you out of your chair and you have to gradually, inch by inch by inch, try to stand your body up straight again. That is not normal. Again, chiropractic adjustments align the vertebra, stimulate your body's own healing capabilities, and as we work through that, the stiffness and the soreness go away. Will my pain last forever? Well, it doesn't have to, but again, this goes back to what your philosophy is. Do you want to be in the best, most optimum shape, and are you willing to do what it takes to create that? Or are you one of those people who says, well, if it ain't broke, I'm not going to fix it? Well, I would challenge you that if you're stiff and sore, you're broken and it's time to fix it. Now, you can go to an MD, but you need to think about what they have to offer you. Or there are other alternatives. Chiropractic would be the top of my list. How is low back pain diagnosed? Well, let's be honest. You're going to tell me. How is back pain in general diagnosed? You're still going to tell me. You're going to be able to come in and tell me, where is the pain? How bad is the pain? How long have you had the pain? Yes, in our office, we're well qualified and we're legally able to make that diagnosis for you. We'll take a complete medical history. We'll do an exam. If we need to, we'll take x-rays or order other tests so that we can diagnose specifically what your challenges are, and then come up with a game plan on how we're going to deal with it and get you back to 100%, or as good as we can get you with what we have to work with. How will back pain be treated? Well, in our office, we use a variety of techniques, but you have to understand that I refer to this as the tennis game. I have to play my part, and you have to play your part, or neither of us is going to be happy. So components in my office obviously include the adjustment. I adjust with my hands, I adjust with tools, I adjust in whatever way I think your body is going to respond, and whatever way you give me feedback as to what you feel is the most effective. Another component is homework. You will always get homework in our office. It could be just ice or heat packs, but it could also be stretches, it could be strengthening exercises, it could be changing your diet, it could be changing your workstation, it could be any number of things related to your lifestyle. There are other tools available like cold laser, which is it's a light that's used to heal the tissue by increasing circulation, decreases pain, decreases inflammation. You usually don't feel anything but maybe a slight warmth. We can use massage. We do refer to massage therapists. We feel that it is a great component to add to the adjustment and helps clear the body out so that the body doesn't have to do that work itself. Additionally, it can help with the lymph flow and it can help keep you more comfortable more quickly. We also do a lot of nutritional review in our office, tweaking the diet and adding in supplementation where necessary. And again, the whole idea is just to accelerate your healing and remove the things that are slowing you down in the first place. So chiropractic care, PT, stretches, strengthening exercises, whatever your body needs, hot and cold packs, potentially cold laser, maybe massage, definitely nutritional and supplements. Now, if you were already told that you need surgery, should you give chiropractic a try? This goes back to your philosophy. I would say that you would want to try every alternative and conservative, quote unquote, therapy out there. I would not want to go under the knife or take prescription drugs until I knew that I had tried everything else available to me. Now, you have to understand, you can't expect permission from your MD or from your surgeon because they don't have anything to gain if you get better somewhere else. You are your best doctor. You should trust your instinct. You should trust your innate. What does your gut tell you? If your gut tells you that you really need surgery, then maybe you need surgery. But if your gut says, I'm not sure, or maybe I should try something else first, then you should trust your instincts. Remember, chiropractor is a drugless method of healing that uses all natural methods of pain control. It dates back to the 1800s. But I want to remind you, the father of medicine, Hippocrates, said, get knowledge of the spine, for this is the requisite of disease. I want to remind you that not all chiropractic offices are the same. Not all chiropractic offices offer all of these services. You may not need all of these services, but it's important to consult and get an evaluation to decide what it is you need, what your best approach is, what your best course of action is, what the pieces of that look like, and then try it out. But I want to remind you that you are your best doctor. You know your body best. Trust your instincts. And if someone is not listening to you, if they're not listening to what you have to say and hearing you, then they don't deserve to be on your health management team. They don't deserve to be on your healthcare team. Build a team around you of people whose opinion you trust, who you feel has your best interest at heart, and then be well adjusted. As always, we love questions. You can contact us at frontdesk@bewelladjusted.com. That's frontdesk@bewelladjusted.com. Or you can call the office 602-712-9444, 602-712-9444. Until we meet again, this is Dr. Carlson of Active Family Chiropractic, Arizona, signing off. Be well adjusted. See you next time.